My name is Raysa Morales-Demori. I'm a pediatric cardiac intensivist at Texas Children's Hospital and also a pulmonary hypertension provider. Congenital heart disease can be diagnosed prenatally or postnatally. When moms are being evaluated during their pregnancy, they undergo ultrasounds that evaluate the heart of the baby, and some of them can be diagnosed then. However, some others are diagnosed postnatally, either during childhood, newborn time, or some even are diagnosed during adulthood. It just depends which type of congenital heart disease you have. So what we know is that some patients require oxygen because their oxygen levels are just low. What low means, it all depends on what type of congenital heart disease you have. When we're talking about patients with biventricular anatomy, what that refers to is that all four chambers of your heart are well formed. You do not have any holes or communications between the right side of the heart to the left side of your heart. In those cases, a normal oxygen saturation is considered when you have over 92%. However, in those patients that have a cyanotic type disease, when I refer by that is those patients that have an underdeveloped chamber or they just could not put all the walls within the heart that underwent a single ventricle palliation is called. In those cases, oxygen saturation may be normal in 75 or 85 unless you underwent a procedure called a Fontan procedure. In those cases, usually over 85% is okay. Anticoagulation is needed in some types of congenital heart disease, either temporarily or permanently. It all depends what type of congenital heart disease you have, what interventions you have had, what is the ventricular function, and what is the severity of your pulmonary hypertension. You may need it permanently. Something to keep in mind is if you are on pulmonary hypertension target medical therapy, that actually may increase your risk of bleeding. So just be cautious and watch for bleeding, rashes, bruises. What we know is that iron deficiency should be treated in all patients with congenital heart disease, especially those that have heart failure. Additionally, if your child has been diagnosed with pulmonary hypertension and congenital heart disease, what we know is that iron supplementation is recommended or at least evaluated if you have iron deficiency. There are different types of procedures offered in patients with congenital heart disease. It could be interventions, but sometimes interventions, meaning repairing the heart or doing palliative procedures in the heart, are not enough. They may need what we call devices. And these devices actually help with the function of the heart. These still may not be enough. And in those cases, we have to think about heart transplantation. There are certain patients with congenital heart disease that need heart transplantations. These patients are the ones that have systolic blood pressure. That means when the contraction of your heart is just weaker. There's something called diastolic dysfunction. These are the cases where your heart does not relax well. There are other failing physiologies that just the patient does not tolerate. In these conditions, heart transplant may be required. What that means is just a replacement of the heart. The best way to determine how we treat congenital heart disease, if it gets diagnosed prenatally, follow with your fetal cardiologist. If it is diagnosed postnatally, you should have a good relationship with your pediatric cardiologist. Some of these patients may need to be hospitalized in the regular floor, in the intensive care unit, or they may be treated as an outpatient. But a good relationship Always. Even though you think that your congenital heart disease got treated, a good relationship with your pediatric cardiologist is always needed. The way we treat congenital heart disease, some of these patients may require medications such as diuretics. Some other ones require blood thinners, or some others may require more advanced medical treatment. All these medications have side effects that will be followed by your pediatric cardiologist.